You may all be seated. A pleasant afternoon to everyone. Today we are going to witness one of the most important events in the lives of our beloved candidates, the BSRD class of 2024. They are joined today by their parents, guardians, and loved ones who inspired them all these years and guided them to the path of finishing the respiratory therapy programs. This memorable event marks the culmination of their rigorous training and journey of becoming breathers of life. This is the 9th Respiratory Therapy Pinning and Awarding Ceremony of San Pedro College. This pinning and awarding ceremony has always been a tradition and is done annually by the San Pedro College Respiratory Therapy Department to send forth our graduating respiratory therapy students into the next level of their career and to welcome them to the professional world. The moment that everyone has been waiting for has finally come. We shall now present to you the 91 candidates for the respiratory therapy pinning and awarding ceremony. The pin that our respiratory therapy students will be receiving is a treasured symbol of association and everlasting bond with San Pedro College. Receiving the pin is an evidence of completing a rigorous and physical demanding RT program and the recognition of the importance and uniqueness of respiratory therapy. As they wear this pin, it illuminates characteristics of Espician respiratory therapists, bearing witness as God's servant would develop competence in critical care and analytical thinking in the delivery of patient care, evaluating and monitoring heart and lung function, and providing safe treatment and management. The investiture of the pin shall be led by the Associate Dean for Respiratory Therapy, Marie-Glenn Heronan, RN, MN, RTRP, Program Coordinator, Soraya Haiktin, RN, MN, RTRP, and will be joined by the RT Clinical Instructors, Karen Kahayag, RTRP, Algesa Sebastian, RN, RTRP. Diola Nicole Angeli B. Biadnes Jandine Rose P. Montejo Roneth Peniver. Sindatok C.D. Farina I. Hamora Marian A. Nahiyal Vicristelin M. Poclaras Marian J. F. Pagangpang Kyle Ren G. Villegas John Lorraine T. Soquano Silene Francis C. Midtimbang by Love E. Otto Satin Azra P. By Maria Luisa H. Ibrahim Sherhada B. Jaime Princess Kyle F. Cagas Ina Angelica P. Alcala Chelsea P. Dana P. Katmaitan Abiphil G. Tatsukami Melrose S. Fortune Crizelda J. Mandine Kate Mecca B. Rabut Teresa Lynn B. Silana Charmaine Alexa U. Francisco Ariane Joy M. Yosma Gisril Shane H. Pongad Maria Cristina L. Reyes Alexandra L. Tagaraw Kiana K. May F. Menor Mary Pagkaw Jenny Kate M. Santiago Ian Daniel J. Dadong Ariane Kyla D. Salas Hazel K. G. Leonardo Merari Nathany Zuriel H. Pantonial Julia Monique D. Canonigo Pauline Alanis S. Gadayan Aliana Joyce. Felicilda Louise Nicole D. Pal Angel Gian I. Ang patuan Misham Izdihar M. Dumalagan Zerlene Ann N. Iglesias Deborah May L. De Palubos Mary Eliza E. Quino Eliza Jaira G. Quahaw Ori Alexa C. Thank you for the first batch of pinners. And now, let's welcome the second batch of pinners. Gia Loren Taranza, RTRP. Jeno Handayan, RTRP. Lloyd Yocades, RTRP. And Levan Hernandez, RTRP. Yap Yari L. Damasin Guinevere L. Uy Carlene Mayer B. Solitaria Leila Nicole L. Zerudo Crizel Pearl P. Padilla Frasia Moana C. Esteban Antoinette C. Tagab Lodenmay A. Ashley Louise B. Baluyos Mary Christine U. Demaala Carlin Priscilla T. Hussein Siti Ziril Hajala K. Peña Mariel J. Infiesto Rubelin Monica B. Gaonera Ronet P. Mata Ana Gabriela V. Tabunan Christian A. Gonzalez Angelo Joshua A. Kanakan Amirul K. Amolong Daniel A. Gigayon Jose Alfonso E. Balatero Mark Raven M. Bolyos Dean Lester O. Swanson Jomar S. Rodriguez Jude Hildrick H. Panuril Joshua D. Calyosan Danev C. Butardo Elisith Nathaniel S. Sahibuddin Arjabal J. Granada Edwin Theodore N. Leda Gian Franco A. Hilanggalan by Mohanessa A. Sismar Grafton J.V. Bilianas Nathaniel Eloise B. Lanes Chabi A. Hidalgo Albert Anthony V. Lim Seth E. Parcon Jester Dave T. Clemente Red Peter. Tan J. Cyril C. Zara Mohammadin T. Torion Romeo Jr. L. Timon Harvey. Thank you to our pinners. Congratulations to all our graduating RT students. Indeed, this is an achievement unlocked. You now have your professional pin. That pin reflects your entry to your professional career. Always wear that pin with pride and smile as you continue to shine in your chosen field as respiratory therapists. It has always been a great pride and honor of San Pedro College to see its graduates make mark and stand out in their different fields or clinical practice, sharing their knowledge and skills to colleagues and workmates, touching the lives of patients and the people around them, living and spreading the spirit of love and service. Each year, the department invites an alumnus or alumna excelling the field of respiratory therapy to share inspiring words and motivate the young, soon-to-be RTRPs. To introduce this year's guest speaker, may I call on our RT Program Coordinator, Soraya D. Hatin, RN, MN, RTRP.
Ladies and gentlemen, to the San Pedro College administrators, headed by our dearest SPC President, Sister Ida T. Francilio OP, our head of SPC Health and Wellness Center, Sister Rachel Darantinao OP, to our Dean of the School of Allied Health Sciences, Dr. Fatima May R. Tesoro, to our Associate Dean of the Respiratory Therapy Department, Mrs. Mariglen G. Heronan, to our dynamic RT faculty, to the proud parents and families and guests, and of course, to all of you, our dearest soon-to-be RT graduates, good afternoon. It is my distinct honor and privilege to introduce our esteemed guest speaker for today's 9th Respiratory Therapy Pinning and Awarding Ceremony, a distinguished professional whose dedication and achievements have greatly contributed to the field of respiratory therapy in the Philippines. Our guest speaker embarked on her academic journey with a Bachelor of Science of Respiratory Therapy preparatory program from 1988 to 1990 at Perpetual Health College in Manila. She then pursued her BSRT proper from 1990 to 1992 at the University of Perpetual Health in Biñan, Laguna, and proudly graduated as part of the 4th batch of BSRT graduates in the entire Philippines in 1992. In 2013, she achieved a significant milestone by earning a grandfather's clause in the respiratory therapy board examinations, further solidifying her expertise in the field. Her commitment to professional development led her to pursue masteral units in public administration at the University of Mindanao from 2015 to 2016, demonstrating her continuous quest for knowledge and excellence. Our distinguished speaker's career is marked by her pioneering spirit and dedication. She became the first respiratory therapist at the formerly Davao Medical Center, or DMC, in 1994, now Southern Philippines Medical Center. Her remarkable journey includes a decade as a job order employee from 1994 to 2004, followed by her tenure as a plantilla employee from 2004 to the present, spanning an impressive 20 years. Her leadership qualities and expertise were recognized when she became the head of the Cardiopulmonary Services Unit in January 2013, a position she has held with distinction up to this day. Her commitment to service and excellence had been honored with the Southern Philippines Medical Center Service Award, celebrating her 20 years of dedicated service as a head employee. Her journey is a testament to the power of perseverance, dedication, and continuous learning. She stands as a beacon of inspiration for all aspiring respiratory therapists and healthcare professionals. Please join me in giving a warm welcome to our respected guest speaker, Mrs. Maria Victoria A. Salonga, RTRP.
Thank you, Ma'am Aya, for that kind introduction. Distinguished faculty members, dedicated RT interns, honored parents, esteemed guests, good afternoon. I am deeply humbled to be chosen as the guest speaker for this significant event. This opportunity is not only a personal milestone, but also a testament to the collective efforts of everyone involved in making this occasion a success. We are gathered here today to mark a momentous occasion in the journey of our respiratory therapy interns. The pinning ceremony we are about to embark upon is not merely a formality. Each pin embodies more than just an achievement. It symbolizes a pledge to uphold excellence, compassion, and an unyielding dedication to preserving life. As I stand before you today, I am filled with a profound sense of nostalgia and pride. Nostalgia for the days when I too walked the halls of academia, a student eager to learn and grow. And even now, after 30 years of practice, I still consider myself a perpetual student, a continuously learning and evolving in this ever-changing field of respiratory therapy. I reflect on the days when I was an intern at the University of Perpetual Health, Biñan, Laguna, back in 1991. Those formative years were filled with rigorous training, invaluable experiences, and countless hours of dedication. It was a time when I was not only learning the technical skills required for my profession, but also understanding the profound impact that our work has on individuals and communities. Into various smaller hospitals, such as Waterers Hospital and St. Luke's Hospital. During our internship, we were not as fortunate as you to have clinical instructors to guide us toward clinical competence. I couldn't seek help from my fellow interns because we were assigned to different wards. It was during that time that I learned to think critically, manage my time effectively, and develop a sense of urgency on my own. I realized that relying on myself during my internship taught me a great deal. It prepared me for the significant responsibility of leading the cardiopulmonary services at SPMC. Looking back in 1994, I applied to what was then known as Davao Medical Center, now Southern Philippines Medical Center, which did not have a pulmonary section at that time. In June of 1994, I received a call from Davao Medical Center informing me that I was hired as a job order respiratory therapist. During that period, a pulmonary team was established at the former Davao Medical Center with myself as the sole respiratory therapist. We integrated into the ECG unit, leading to the creation of cardiopulmonary services, commonly known as CPS. In that very year, a head nurse from the recovery room approached me, informing me that Sister Taxon from San Pedro College expressed interest in establishing a respiratory therapy program. She requested a copy of my transcript of records, presumably for their reference. As anticipated, San Pedro College established its Bachelor of Science in Respiratory Therapy program
in 1995 and produced their first batch of RT interns in 1998. Davao Medical Center welcomed its first group of RT affiliates, and I'm pleased to mention that our very own Vice President Inday Sara Duterte was among them. Until now, SPMC has remained one of the largest training hospitals, providing extensive opportunities for hands-on training. Its facilities and resources offer a comprehensive environment where medical professionals, including doctors, nurses, and respiratory therapists, can gain practical experience. This commitment to training ensures that healthcare providers are well equipped with the skills and knowledge necessary to deliver high-quality patient care. SPMC's role as a premier training venue continues to attract a of trainees, solidifying its reputation as a leading institution in medical education and professional development. As a parent, I am truly happy and proud of what you have accomplished on their behalf. Your success also brings immense joy and pride to them who have supported and encouraged you along the way. May their happiness be a source of motivation for you, reminding you of the love and effort invested in your education. Wear your pin with pride. Remember the countless hours of duty, practice, and perseverance that have brought you to this moment. Also remember that this is just the beginning of a journey filled with endless possibilities and opportunities to make a future in healthcare services. Let it fuel your determination to always strive for perfection, to never stop learning, and to continuously push the boundaries of what's possible in respiratory therapy. The pursuit of knowledge does not cease after internship. Your diploma comes next. It's the most meaningful gift you'll give to your parents. Equip yourselves with perseverance to face adversity. When confronted with doubts, remember the strength within you. And when challenges seem insurmountable, remember the passion that drives you through. In the field of respiratory therapy, every second counts and every action matters. Your decision to embark on this path reflects your desire to make a profound difference in the lives of others. Whether it's administering ECG, managing cardiac emergencies, or providing critical care, you are the frontline heroes, the ones who stand ready to bring hope and healing in moments of crisis. But remember, with great skills comes a great responsibility. Your pin isn't just a symbol of achievement. It's a reminder of the trust placed in you by those you serve. As you step forward into the next chapter of your journey, do so with confidence, courage, and kindness. Let your dedication inspire those around you. Finally, placing the Almighty at the center of our endeavors is akin to having a constant guiding light. This spiritual focus can help steer us toward decisions and actions that are in harmony with our values and beliefs. With the Almighty as our guide, we are more likely to pursue paths that lead to personal growth, fulfillment, and service to others. This central focus can provide a sense of direction and stability, especially during times of uncertainty or difficulty. It encourages a life grounded in the understanding that there is a higher purpose to our existence. Congratulations to each one of you. May your journey in respiratory therapy be filled with boundless success. Thank you, and God bless us all.
I am confident that the experiences you shared and your words of wisdom would serve as an inspiration to the BSRT Black class of 2024. At this juncture, to award the token of appreciation to our guest speaker, I would like to request our college President, Sister Ida T. Francilio OP, and the Associate Dean for Respiratory Therapy, 𝘰𝙤𝙥𝙾𝙢𝙀, RN, MN, RTRP, to assist in the presentation of the certificate. Citation reads, a certificate of appreciation is presented to Mrs. Maria Victoria A. Salonga, RTRP, for imparting her valuable time and dedication as guest speaker during the 9th Respiratory Therapy pinning and awarding ceremony held today, given this 9th day of June at Dusit Thani Hotel, Davao City. Signed by the Associate Dean for RT, 𝘰𝙤𝙥𝙾𝙢𝙀, RN, MN, RTMA, R Tesoro, RPH, MS Farm, and the VP for Academics, Dr. Ana Julia Piñero, and the President, Sister Ida T. Francilio OP. Again, to our guest speaker, thank you very much. And now, we are in one of the highlights of this event, the award. It is a valuable opportunity to celebrate our students' successes by recognizing their outstanding performances in various fields of involvement. To award the special and clinical awards, may I call on our college president, Sister Ida T. Francilio OP, the head of SPC Health and Wellness Center, Sister Rachel Darantinao OP, and Associate Dean for Respiratory Therapy, 𝘰𝙤𝙥𝙾𝙢𝙀, RN, MN, RTRP, assist in the presentation of the certificate. And to read and present to us the names of the awardees for the non-clinical awards, may I call Geno Handayan, RTRP, co-chairman of the awards committee, and to present the clinical awards, may I call Karen Kahayag, RTRP, chairman of the awards committee.
For the research awards, let me read the content and citation. San Pedro College, School of Allied Health Sciences, Respiratory Therapy Department, Certificate of Recognition is awarded to our awardees, given during the 9th pinning and awarding ceremony this 19th day of June 2024 at Dusit Thani Hotel, Davao City. Signed, Dr. Elsa May Baron, Director of the Research, Publication, and Innovation Center. 𝘰𝙤𝙥𝙾𝙢𝙀, RN, MN, RTRP, Associate Dean for Respiratory Therapy. Dr. Fatima May R. Tesoro, Dean, School of Allied Health Sciences. Dr. Ana Julia Piñero, VP for Academics. Sister Ida T. Francilio OP, President. For the departmental 3-minute pitch competition, the competition was held last April 26, 2024 during the Research, Development, and Extension Week celebration at San Pedro College, Davao City. There were a total of 11 research entries that have participated in the competition, and here are the winners. Third place is awarded to Bongat Maria Cristina, De La Peña Mariel, Dilangalen by Muhanesa, Otto Satin Azra, Padilla Freja Moana, 𝘰𝘸𝙪𝙀 Jaira, Regina Ashley Lois, Selana Charmaine Alex, Sukwano Silene Francis. For the research title, Breathe Anew, the Lived Experiences of COVID-19 Survivors Among Students. Mentor, Marie Glenn G. Heronan, RN, MN, RTRP. And also, third place is awarded to Infiesto Monica, Jaime Princess Kyle, Lim Seth, Liagas Jan Lorraine, Lumbay Maria Luisa, Mandin Kate Smeka, Leonardo Merari Natane Zuriel. For the research title, Transitioning to the Normal Experiences of Respiratory Therapy Interns in Online Internship Program. Mentor, Dr. Samuel F. Migallos, RN, MAN. Still, third place is awarded to Francisco Arian Joy, Gadayan Aliana Joyce, Cahunera Ronet, Gigayon Jose Alfonso, Granada Edwin Theodore, Hidalgo Albert Anthony, Ibrahim Sherhada. For the research title, Health-Seeking Behavior Among Construction Workers, a Silicosis Awareness. Mentor, Dr. Samuel F. Migallos, RN, MAN. Second place is awarded to Demaala Carlene Pichela, Depalubos Mary Eliza, Clemente Red Peter, Dadong Arian Kayla, Diola Nicole Angeli, Felicilda Luis Ticole. Research title, Predictors of Success in Licensure Examination Among Graduates of Respiratory Therapy. Mentor, Dr. Samuel F. Migallos, RN, MAN. our champion for the 3-minute pitch competition is awarded to Panuril Joshua, Santiago Ian Daniel, Solitaria Leila Nicole, Swanson Jomar, Tabunan Christian, Taga Bloden May, Tan J. Cyril, Timon Jarvi, Uy Carlin Mayer. Research title, Perspective on Respiratory Therapy Services Among Residents of Davao City. Mentor, Dr. Samuel F. Migalios, RN, MAN. Congratulations to our research awardees. And now, for our special awards, these awards are given to the candidates in recognition of their outstanding involvement in in-school and inter-school competitions, representing SPC and the RT department, and as well as the candidates with valuable involvement in community engagement and extension. These awardees were highly recommended by the respective offices of San Pedro College. Citation, San Pedro College, School of Allied Health Sciences, Respiratory Therapy Department, Certificate of Recognition is awarded to our awardee. Given during the 9th pinning and awarding ceremony this 19th day of June 2024 at Duce Tani Hotel, Davao City. Signed by the respective office director or club moderator, Marie Glenn G. Heronan, RNMN RTRP, Associate Dean for Respiratory Therapy. Dr. Fatima May R. Tesoro, Dean of School of Allied Health Sciences. Dr. Ana Julia P. Inero, VP for Academics. Sister Aida T. Francilio, OP, President. Our first special awardee is recognized for her invaluable involvement in community engagement and extension services of San Pedro College. The certificate of recognition is awarded to Ibrahim Sherhada. Another certificates of recognition is awarded to for their invaluable involvement in the cross-border internship in Malaysia last October 2023. Given to Ampatuan Misham Isdihar, Bilanggalan by Muhanesa, Fortune Crizelda, Granada Edwin Theodore, Kusain City Ziril, Otto Satin Azra, Sukwano Celine Francis, Boclaras Marian J, Cagas Ina Angelica, Clemente Red Peter, Dadong Arian Kayla, Diola Nicole Angeli, Leonardo Mirari Natane, Padilla Freja Muana, together with the CIs Rochi B. Apa, RTRP, Karen V. Kahayag, RTRP. also, certificates of recognition is awarded to Balatero Mark Raven, Timon Jarvi, Tabunan Christian, Cagas Ina Angelica, Dadong Arian Kayla, Padilla Freja Muana, Soquano Silin, for their invaluable involvement in the collaborative online international learning. Now, certificates of recognition is awarded to 𝘿𝙤𝙛𝙧𝙞𝙢𝙀𝙡 RN RTRP, Soraya D. Haiktin RN RNMN RTRP, Rochi B. Apa RTRP, Karen V. Kahayag RTRP, for their invaluable involvement in the smoking cessation service provider program. Certificates of recognition is awarded to 𝘤𝘫𝑥𝙑𝑒 Taranza Gia Lore for being the champion during the 30th National Respiratory Care Week 19th General Assembly and Annual Conference ARCPP Pautakan Baga Quiz B Professional Category. And also, certificate of recognition is awarded to Hernandez Livan for being the coach during the 30th National Respiratory Care Week 19th General Assembly and Annual Conference ARCPP Pautakan Baga Quiz B Student Category. For the seminar awards, these awards are given to the candidates who excelled in their respiratory care seminar. The following awardees were highly recommended by the respective professors in the respiratory care seminar. Allow me to read the citation. Plaque of recognition is awarded to our awardees, given during the 9th pinning and awarding ceremony this 19th day of June 2024 at Dusit Thani Hotel, Davao City. Signed, Mariglen G. Hironan, RN, MN, RTRP, Associate Dean for Respiratory Therapy. Dr. Fatima May Artesoro, Dean of School, Palad Health Sciences. Dr. Ana Julia P. Enero, VP for Academics. Sister Aida T. Francilio, OP, President. The awardees are Balatero Mark, Cagas Ina Angelica, another plaque of recognition, 𝘾𝙤𝙤𝙤𝙤 Angelica. Mora Marian. Plaque of recognition awarded to 𝘿𝙤𝙤𝙀𝙀 𝘠𝑒𝑟𝑖L. Plaque of recognition is awarded to 𝘾𝙤𝙥𝙮𝙐𝙐𝑒𝑣𝑟𝑒. Plaque of recognition is awarded to Salas Jazel. Congratulations to all special awardees.
Good afternoon. Allow me to read to you the criteria for the clinical awards for the Respiratory Therapy Department. The candidate must be a fourth-year respiratory therapy student. He or she must not have committed any major or minor offense and which have necessitated appearance before the Committee on Clinical Conduct or Student Conduct Committee. He or she must be highly recommended by the program coordinator, clinical instructors, and the respiratory therapists who have supervised him or her in various clinical settings. The student must have a clinical education weighted percentage average grade of 85% or better, with no grade below 80% in any clinical area, both in Clinical Education 1 and 2. Our awardees will receive a plaque of recognition with the following citation: San Pedro College, School of Allied Health Sciences, Respiratory Therapy Department. Plaque of recognition is awarded to our awardees for his or her outstanding performance in specific area, given during the 9th pinning and awarding ceremony this 19th day of June 2024 at Dusit Thani Hotel, Davao City. Signed, Marie Glenn G. Heronan, RN, MN, RTRP, Associate Dean for Respiratory Therapy, Dr. Fatima May R. Tesoro, RPH, MS Pharm, Dean of School Allied of Health Sciences, Dr. Ana Julia P. Enero, VP for Academics, and Sister Ida T. Francilio, OP, President. Before I present to you the Respiratory Therapy Clinical Awardees for 2024, please watch this AVP presentation. In behalf of the RT Awards Committee, I am honored to present to you the 7 RT Clinical Awardees. Outstanding performance in Adult Intensive Respiratory Care. Outstanding performance as practicing in clinical instructor. Hidalgo Albert Anthony. May I request the parents of Mr. Hidalgo to escort May I request the parents of Mr. Hidalgo to escort Outstanding performance in General Respiratory Care, Community Respiratory Care, Adult Intensive Respiratory Care, 𝘵𝘂𝘶𝙀𝑖𝑛 Guinevere. May I request the parents of Miss 𝘵𝘂𝑖𝑛 to escort her. Outstanding performance in Adult Intensive Respiratory Care, Pediatric Intensive Respiratory Care, General Respiratory Care. Outstanding performance as practicing in clinical instructor, 𝘰𝘠𝙥𝙀. May I request the parents of Miss 𝘰𝘠𝙥? Outstanding performance in Adult Intensive Respiratory Care, Community Respiratory Care, General Respiratory Care, and outstanding performance as practicing clinical instructor, 𝘬𝘠𝙥𝙀. 𝘬𝘠𝙥𝙀. Outstanding performance in Adult Intensive Respiratory Care, Pediatric Intensive Respiratory Care, General Respiratory Care, and practicing in clinical instructor. Outstanding performance in Adult Intensive Respiratory Care, Community Respiratory Care, General Respiratory Care, and outstanding performance as practicing clinical instructor, Salas Hazel K. Outstanding performance in Pulmonary Diagnostics, General Respiratory Care, Adult Intensive Respiratory Care, Pediatric Intensive Respiratory Care, Community Respiratory Care, De La Peña Moriel. outstanding performance in pulmonary diagnostics, general respiratory care, adult intensive respiratory care, pediatric intensive respiratory care, community respiratory care, and outstanding performance as practicing clinical instructor. Balatero Mark Raven. Congratulations to all our clinical awardees. Thank you.
Once again, congratulations to all the awardees. Indeed, you have done your best and shown your utmost effort to stand out among your batchmates. And to the proud parents, the seed you sowed have finally grown and you are now reaping the fruits of your labor. Congratulations. Our BSRT graduating students hurdled 3 years of college foundation, not to mention the challenges brought about by the COVID-19. This pandemic has shifted traditional classroom learning to a flexible online method. It was then culminated with 1 year face-to-face internship, giving them the opportunity to practice and develop their skills. They are able to endure approximately 1,600 hours clinical internship, surmounted 10 clinical rotations in 5 different areas of respiratory practice across our affiliating hospitals and institutions. They have accomplished a countless number of journal readings, drug studies, RT care plans, case studies, and case presentations. I bet it was a roller coaster ride, am I right? With that being said, there's no better way for us to give light on what they have been through throughout the years but to hear from the candidates themselves. To give us a message on behalf of the Respiratory Therapy class of 2024, may I call Mark Raven Balatero.
To our school administrators, headed by Sister Ida T. Francilio OP, to our Vice President for Academics, Dr. Ana Julia P. Enero, to our department administrators, the Dean of the School of Allied Health Sciences, Dr. Fatima May R. Tesoro, RPH MS Pharm, to our Associate Dean, Mariglen G. Heronan, RN MN RTRP, and to our Program Coordinator, Soraya D. Haiktin, RN MN RTRP, to our esteemed faculty and staff, parents, guests, and fellow respiratory therapy interns, a pleasant day to all of you. Each one of us has a different story to tell. Countless chapters have been unveiled with every milestone we shared. Our 4-year journey as respiratory therapy students can be described as a trilogy, with 3 titles narrating the incredible story of our perseverance and sacrifices. Book 1, Choice. Before we set foot in San Pedro College, we always wondered what our fate would be. Were we destined to become a lawyer, a doctor, a content creator, a vlogger, or a TikToker? Numerous professions crossed our minds, occupations we envisioned ourselves pursuing. But when we arrived at San Pedro College, we made a choice that changed our outlook in life, redefined our character, and gave us purpose. Pursuing respiratory therapy sparked many questions for most of us. Why RT? We have been asked this question multiple times, and the answer varies for each of us. It may be because of the influence of our relatives, the high demand for employment abroad, or even the aesthetic presentation of our scrubs. Whatever the reason, I can only say we've made the right choice. But with these choices, we must remember to stand up for them. We have to fulfill the promise to finish what we started, along with the principles and knowledge that were bestowed upon us. As this profession requires strength of mind and body, we gave our best through hard work and dedication to be in this position. Who could have wondered that our choice years ago would lead us to being professionally pinned and soon to be BSRT graduates? Book 2, Remembrance and Gratitude. Throughout our affiliation with our program, we were trained and taught concepts and values that served as a foundation for us to become effective and efficient healthcare providers in the future. From learning how to extract arterial blood gas to manipulating mechanical ventilators, we acquired lessons that represent the essence of a respiratory therapist. This understanding is further amplified when we are immersed in the actual healthcare setting. Dealing with patients with different cases is a tough duty to uphold. Yet the satisfaction of being able to provide hope and aid is life-changing. Do you remember the first patient you handled? Or the first patient you revived after CPR? Those moments reflect our eagerness to voluntarily help those in need without a hint of hesitation. And they make us feel proud as a respiratory therapist. But not all moments were successful. Some mishaps tested our resilience. Moments such as major revisions of case presentations, especially those times when we create our RT care plans and input difficulty of breathing even though there was no use of accessory muscles. Forgetting lines in the RT oath during morning circles and additional readings and drug studies as sanctions. Some of us might take these kinds of mistakes gravely, yet they happen not to degrade our capacity, but to inspire us to become better versions of ourselves. We must remember these failures so that we can understand that every decision we make can have an impact that brings either positive or negative effects. Besides our mistakes, we must also look back on the wholesome memories that made our college life bearable. Simple invites during study outs, lunch or dinner breaks at the famous Vikings outside SPMC, and even casual talks just to ease the tension before taking an exam. We enjoyed every single moment with the people who brought smiles to our faces despite the hardships we experienced. Cherish and give importance to these chapters, because as soon as we wander onto our different paths, we can only review them through photographs, videos, or our memories. Let us also remember the significant people who are essential to our lives, motivating us to continue moving toward our goals. To our institutional and departmental administrators, we express our gratitude for your service in providing us with opportunities that deliver exponential benefits and for introducing this program, which carries our innate skills into the healthcare world. To our clinical instructors, Ma'am Karen, Ma'am Rochi, Ma'am Cass, Ma'am Aljessa, Ma'am Gia, Sir Jeno, Sir Livan, and Sir Lloyd. Thank you for imparting your expertise and values that taught us to look deeper into our potential and bring out the best we can do. You are not just our CIs, but also our second parents. To our parents, Ma and Pa, we owe this achievement to you. You sustained us with your unconditional love and sacrifices. Your blood and sweat served as the pillars that molded us. To our classmates and friends, your loyalty and support kept us sane. Your existence will forever be valuable. Thank you for the tears and laughter we shared that provided a meaningful impact into our lives. May we continue this bond that gave us the motivation to strive what we have achieved. Lastly, to God, who provided us with great experiences and opportunities. Without Him, we wouldn't be able to enjoy and savor what we have earned today. Book 3, Survive. As you look at your pin, may it uphold its symbolism. The blue color represents the respiratory therapy program, the school color, which signifies loyalty to the gospel of Christ, and the gold color refers to the honor and glory of God. When we receive this pin, may it be a reminder of how we survive anxiety, overthinking, self-doubt, and pain. Throughout these stepping stones, we develop competence in not just handling cardiopulmonary services, but also providing our patients with holistic care. So trust in yourself, for our efforts will never be invalidated, ensuring that whatever challenges and obstacles come our way, we can conquer them all. As this book comes to an end, may we create new chapters. May our choices be bold, our future milestones be memorable, and our gratitude be meaningful. Now, let us work on our next book, entitled RTRP. Before I end this speech, let me read a quote by Rainer Rilke that states, "The purpose of life is to be defeated by greater and greater things. You've overcome more than you think. Just keep surviving." Thank you and congratulations, Breathers of Life.
Thank you for that message, Mark. Indeed, the training was difficult, but the results are definitely worth it. The respiratory therapy prayer has been a constant source of inspiration and guidance of our RT students during their internship as they recite it each and every day before they begin their clinical duties. This constantly reminds them that they are the vessels of God's caring hands and breath that gives life to the patients in need. In the same way that the respiratory therapy oath serves as a foundation of the RT profession, instilling to them that an SPCN respiratory therapists, we commit ourselves in doing our duties to care for patients with competence without any prejudice and discrimination. Let us all witness our graduating RT students as they pray and take oath. To lead the candidates in prayer, may I call 𝘲𝘪𝘨𝙀𝙀. And to lead the respiratory therapy oath, may I call 𝘲𝘪𝘨𝙀𝙀.
the respiratory therapy prayer. Heavenly Father, as I begin this day, I humbly ask for your guidance with your divine hand. Inspire, lead, and give me wisdom throughout the day. Breathe into me one breath of life to help people that come my sight. Bless my hands that care the sick, to give hope to those I am called to serve. I seek your strength, and I ask that you breathe on me, the Holy Spirit, as I make decisions for the good. Teach me to give my best, to speak with love, and to act with courage. May my patients consider me as their breathing guide when they are in distress. I ask you to turn their weaknesses into strength, sufferings into compassion, sorrow into joy, and pain into comfort. May their minds be relieved of anxiety, and may their souls be stroked by your divine love. Amen.
The Respiratory Therapy Oath. With full awareness of the vast responsibilities that lie ahead, I solemnly pledge to care for my patients with all competent knowledge, skills, and highest degree of professionalism. I vow to give honor and glory to the respiratory therapy profession by exerting all effort to conserve meaningful life, to alleviate suffering, and to promote health. I will endeavor to treat every patient and ease their pain with dignity and utmost confidentiality. I will perform my duties efficiently and with sensitivity with regards to patients' ethnicity, creed, religion, social status, and political affiliation. I will pursue lifelong learning to counter my limitations as a person and as a professional. I will do my best to maximize the potentials of my being a respiratory therapy professional and to uphold and advance the standards of my profession. So help me God.
For this batch, it was a journey truly anticipated, struggled and accomplished. They had their friends, mentors, and parents to guide them in the journey, inspiring them to continue moving forward with a caring heart. Class 2024 stands proud and grateful to these people who are and always be the wind beneath their wings. Each year, each batch composes an original song that somewhat summarizes their entire RT journey. A song that tells us their dreams and aspirations, tales of trials and successes, and stories of hardships and victories. Ladies and gentlemen, let us listen to the Batch 2024 with a batch song entitled Breakthrough. Thank you, BSRT Batch 2024, for that heartwarming song. Your journey towards your RTRP goal had faced and will still be facing more roadblocks and detours, but for sure, the journey will all be worth it. Batch 2024, this event marks a momentous milestone in your professional journey. But this is just the end of one chapter and start of another, and that is your licensure examination journey. San Pedro College has constantly been one of the top performing schools of respiratory therapy in the Philippines for the past years, with board placers each year. Top 1 performing school in 2014 and 2015. Top 2 performing school in 2016, 2017, 2018, 2019, and 2023. And just recently, last February 2024, respiratory therapy licensure examinations, top 2 performing RT school in the Philippines, and nothing follows. May this serve as an inspiration and a challenge to all of you that you may strive even harder to keep that reputation, or better yet, exceed expectations as you achieve your individual goals of becoming future RTRP. Respiratory therapists registered in the Philippines. Good luck to each and every one. Ladies and gentlemen, the pinning and awarding ceremony has come to an end, but the challenge has begun for Batch 2024. I would like to thank the parents, guests, members of the faculty, the administration, the Board of Trustees, our guest speaker, and the different committees who heartily contributed for the success of this event, and all those who have been part in the lives of our aspiring, vibrant, hopeful graduating respiratory therapy students. Thank you very much. Again, to Class 2024, future breathers of life, congratulations and best luck to your future endeavors. Please stand for the singing of the SPC hymn, and please remain standing in the exit of colors and the recessional of the RT Council.
It's love alone that transcends mankind, with your SPC behind. Love stirs to every living image of our dear and loving Christ. So let your heart be full of true love, serve the sick and needy ones. Let your touch bring forth the ray of sunshine, be the light to all mankind. Oh, say that we shall never falter in our task as Christians true. Oh, say that we shall hoist the banner of the SPC white and blue. If there are storms to darken our way, take our stand and proudly say that we live to lift the clouds of darkness and enrich humanity.